Hello, I'm Dr. Brent Gibson, and tonight I want to talk to you about nerve malfunction. So with peripheral neuropathy, we are constantly talking about the nerves not working, and some individuals even say your nerves are dead. They just stopped working completely. And the truth is, really, peripheral neuropathy is not absence of nerves or death of nerves. It's really a nerve malfunction most of the time. So when a nerve malfunctions, there's really 4 different ways that it could present. It could present where it has no signal, where it says, okay, there's really nothing going on. It's not working at all. Most common way is if you were to cut a nerve, then you stop the signal. There's no signal happening. That is a very small percentage of peripheral neuropathy. But it's something that should be considered as a possible nerve malfunction where the nerve can no longer communicate because there is loss of a signal. Number 2 would be that the nerve signal is traveling so slow that the body's unable to interpret it correctly, or the brain is unable to interpret it correctly. So it's traveling so slow. One of the possible reasons for that would be, say, if you lose the myelin sheath, the cells that surround the nerve that cause it to travel more quickly, if those die, or are damaged in some way where they don't continue to function like they're supposed to, then you'll get a slow nerve signal. Number 3 would be that you get a weak signal. This could be because of loss of the mitochondria in the cells where the mitochondria are dying. You don't have enough energy to get the signal across. It could be loss of certain types of proteins. It could also be loss or damage of the neurotransmitters. So you're not getting a signal strong enough to really give a true indication. And the 4th is the signal is working completely normal. It's getting where it needs to go. It's doing exactly what it's supposed to do, but it's sending it in such a way that the brain and the spinal cord can't interpret it. So you've got the peripheral nervous system that's sending a signal that the central nervous system can't understand. And so it interprets it as something different. So a good example of this is if you were walking across a cold linoleum or a cold tile floor, your feet feel the cold, they send the signal to the brain. Because it's sending it in the wrong way, then you actually get a return information that it's painful. So you get severe pain from the cold surface, even though really that's not the problem, it's cold. But the brain is interpreting the signal from the nerve incorrectly because it's being sent incorrectly. So in all of these cases, there are things that can be done to treat the nerve malfunction and help it improve. But the important part to understand is that the nerves haven't stopped working in most cases. They are malfunctioning. They're sending the signal either too slow, too weak, or even incorrectly, erroneously. So that being understood, there are definitely things that can be done for peripheral neuropathy. If you would like more information, if you're saying, okay, I really need to know more about this, then I invite you to learn more about the Neuropathy Bootcamp, where we can actually take you through and find out how your individual nerves are malfunctioning and hopefully allow you to get back to normal functioning by teaching you to manage the symptoms, to stop the nerve damage, and ultimately to thrive and have an extraordinary life even with peripheral neuropathy. This is Dr. Brent Gibson, and this is your neuropathy